Medical mycology plays a crucial role in public health. It's a field that focuses on fungal infections in humans. These infections can be life-threatening, especially for people with weak immune systems. The Third Balkan Conference on Medical Mycology and Mycotoxicology highlighted this importance. It brought together experts from across the region and beyond. The conference aimed to address current challenges in the field. Climate change is altering the spread of fungal pathogens. New drug-resistant strains are emerging. These issues make fungal infections a growing concern. The conference provided a platform to discuss these challenges. It also explored potential solutions. Fungal infections affect millions of people worldwide. They can range from minor skin irritations to severe systemic infections. Some can even be fatal if not treated properly. The conference stressed the need for better diagnostics and treatments. It also emphasized the importance of regional collaboration in tackling these issues. The event covered a wide range of topics. These included the latest research findings and real-life case studies. Experts shared their knowledge on antifungal susceptibility testing. They also discussed the management of infections in critical care settings. The conference served as a crucial platform for knowledge exchange and networking in the field of medical mycology. Another presentation explored the impact of climate change on respiratory fungal infections. As temperatures rise, certain molds are becoming more prevalent in indoor environments. This is leading to an increase in allergic reactions and respiratory infections. The speaker emphasized the need for better indoor air quality monitoring. They also discussed strategies for reducing mold growth in buildings. The session also touched on how climate change might affect mycotoxin production. Some studies suggest that warmer temperatures could increase mycotoxin levels in crops. This could have serious implications for food safety and public health. The experts called for more research in this area. They stressed the importance of adapting agricultural practices to mitigate these risks.
Candida auris was a hot topic at the conference. This emerging fungal pathogen has caused alarm in the medical community. It's resistant to multiple antifungal drugs. It can also spread easily in healthcare settings.
Experts shared the latest findings on Candida auris epidemiology and treatment strategies. One Meet the Expert session focused on Candida auris identification. The fungus is often misidentified using standard laboratory methods. This can lead to inappropriate treatment and further spread.
The expert discussed new diagnostic techniques that can accurately identify Candida auris. They also emphasized the importance of surveillance in controlling outbreaks.
Another session explored other emerging fungal threats. These included drug-resistant strains of Aspergillus fumigatus. This mold can cause severe lung infections in immunocompromised patients. The experts discussed the growing problem of azole resistance in Aspergillus fumigatus. They also presented new approaches to treating these resistant infections.
The experts also touched on rare but serious fungal infections. These included Mycoses and Mucormycosis. These infections are becoming more common in certain regions. The speakers stressed the need for increased awareness among healthcare providers. They also discussed challenges in diagnosing and treating these rare infections.
Interactive case studies formed a crucial part of the conference. These sessions allowed participants to apply their knowledge to real-life scenarios. One case study focused on Mucormycosis, a rare but deadly fungal infection. Participants discussed the challenges of early diagnosis and aggressive treatment.
The Mucormycosis case highlighted the importance of a multidisciplinary approach. It involved input from infectious disease specialists, surgeons, and radiologists. The case demonstrated how early intervention can improve outcomes. It also showed the need for better antifungal drugs to treat this aggressive infection.
Another case study dealt with fusariosis in a leukemia patient. Fusarium species can cause severe infections in people with weakened immune systems. The case illustrated the difficulties in treating these infections. It also showcased new combination therapy approaches that show promise.
The aspergillosis case study was particularly engaging. It focused on a patient with chronic pulmonary aspergillosis. This condition can be challenging to diagnose and treat. Participants discussed the pros and cons of different treatment strategies. They also explored the role of surgery in managing complex cases.
The second day of the conference focused heavily on respiratory infections. Experts discussed how fungal pathogens can complicate these infections. This topic has gained importance in light of the COVID-19 pandemic. Many COVID-19 patients have developed secondary fungal infections.
One session explored the link between influenza and invasive aspergillosis. This combination can be deadly, especially in critically ill patients. The speakers presented data on the incidence of this complication. They also discussed strategies for early detection and treatment. The session highlighted the need for fungal screening in severe flu cases.
Another talk focused on fungal infections in cystic fibrosis patients. These individuals are at high risk for chronic fungal colonization of the lungs. The speaker discussed the challenges of managing these infections. They also presented new approaches to preventing fungal complications in this population.
The final part of this section dealt with fungal biofilms in the respiratory tract. These structures allow fungi to resist antifungal treatments. The experts discussed new research on biofilm formation and dispersal. They also explored potential therapies that target biofilms. This could lead to more effective treatments for chronic fungal respiratory infections.